bringing you the news and information you need from the people making a difference. This is COMCAST Newsmakers.
Hi everybody, welcome back to Newsmakers. Amblyopia is the top cause of vision loss for kids, but it can be treated if it's diagnosed before the age of 5. Here to explain this is this hour's newsmaker, Dr. Bruce Miller, Medical Director of Pediatric Ophthalmology at the Chris Everett Children's Hospital at Broward General. Thank you very much for joining us.
Thank you for having me.
This is something that parents can have a direct effect on just by noticing how the children's eyes are.
The first part of your statement is correct. The second part is not. That's the whole point of what we're trying to do, is to educate parents that if you look at your child, and most of the time they're going to look absolutely perfectly normal. We hear it all day long. Little Johnny looks normal. I didn't know anything was wrong. How would I have known something was wrong? He can see perfect 20/20 out of his right eye, but maybe legally blind out of his left eye. And how would you know he can function perfectly with his one good eye?
Now, when we say lazy eye, is that a drifting eye, or is it just an eye that can't see very well?
Lazy eye means that it's one eye cannot see well compared to the other eye. A lot of people think that a droopy eyelid is a lazy eye, or an eye that drifts out or in is a lazy eye. That's really a different entity. That is called strabismus, misalignment. But a lazy eye is amblyopia, which is what we are trying to prevent, and we can do that if we get the word out.
What's the cause?
The cause can be many different things. It can be that one eye has a different refraction than the other. So in other words, you could have a normal, let's say, right eye, and your left eye is very nearsighted, very farsighted, has a lot of astigmatism. There can be something in the way, like a cataract, even in a child.
We have pictures of you at work here, and this is a common exam that takes place just to make sure the child has good vision?
It's really simple to do an examination on a child. I think that's another misconception, is people think, well, my child is really not old enough to be cooperative for an eye exam, and yet even a baby can have a good eye exam. As long as we can dilate the pupils, we can see in and get a world of information.
Now, what do you look for here? And again, how do you correct it if you find it before the age of 5?
Well, this program that we're really promoting is about educating parents around the world, really. People just don't know that. They know to get their kids' teeth checked at age 3. They know to get their hearing checked by a young age, but for some reason, parents don't know to get the children's eyes checked before they start kindergarten. And if we can educate every parent before they, just a simple thing, before your child starts kindergarten, make sure, wherever you live in the country, make sure you find somebody who can do a good vision screening, check one eye, check the other eye, and make sure that child is not at risk for amblyopia. It's as simple as that.
Now, if you're diagnosed with amblyopia and you're before the age of 5 years old, what do you do to correct the problem?
Well, that really depends on the cause of amblyopia in that particular child. But for the most part, if a child has a lazy eye, and you find out the reason is because one eye needs glasses and the other eye doesn't, or one eye needs more prescription than the other, then you can make a special pair of glasses, put it on the child, see them back in, let's say, 2 months, and a lot of times you've just cured it right there.
You'd have.
If that doesn't work, then you start some form of what we call occlusion therapy, where the most common way to do it is to put a patch on the good seeing eye to force the other eye to work harder. And like you've mentioned already, if you get it by the age of 5, it's very simple to reverse the process. If you get it at 6, 7, 8, 9, the older you are, the more difficult it is. And then once you turn about 8, 9, or 10, it's too late.
Very interesting. Well, thanks very much for bringing this to our attention. This hour's newsmaker, Dr. Bruce Miller, discussing amblyopia, or lazy eye, which is the #1 cause of vision loss in children. I'm SPIRO CANTON. Thank you for watching.
The preceding